Hi, my name is Megan Young. My student ID is 2450620. I'm taking the course Laboratory Animals, VTHT 2213. Thank you. Enjoy.
Okay. Okay, so here we have our little female rat, and she's all nice and comfy in her little cage. So what I'm going to be talking about today is just kind of, husbandry talk, essentially. So this is a great cage to have for her. The bedding is nice and soft for her. It soaks up the urine, keeps the poop on top, so it can be easily scooped out. The water over here is great for her, so she can have an easy access all the time. Let me show you her little pellets that she has in here. Okay, really? How do you get this open?
Yeah.
Okay, there we go. Okay. All right, the pellets that she has in here are small and large. So this is a great feeding, the way you can feed her. That way she has access that she can grind her teeth on. She has a little hideaway spot. Nutritional wise, like I said, the pellets are great. She can have a little bit of lettuce, some little strawberry tops. So this is a great setup for our little female rat here. So she's being a little shy right now, but I'm going to go ahead and transfer her over. So far as handling wise, now with rats, you can either, if they're aggressive, you probably would want to wear gloves, but with her, she seems pretty docile, so I'm just going to go ahead and pick her up by her tail and transfer her over to her new cage. Little one. Hey, honey. No, come here. It's okay. Just gonna put my hand under her to support her. Make sure she doesn't get out. Close her on up. Okay, so we have here our little female rat. So right now I'm going to demonstrate how to restrain her. One way, a great way, is the towel. She's not very happy with us right now, so another way to scruff her is to scruff her. You can scruff her in the towel. Make sure we've got so she can't get away from us. And another way is to hold her by her side. I know you're very angry. Is to hold her under her chin and to hold her like this. This is the way we restrain rats. Okay, one more. Go. Okay, so I'm going to demonstrate how we tell the difference between a male and a female. So here we have a little female rat, and you can tell here that the little genitalia is closer together, and the male rat would be more like this. So far as reproduction goes for rats, the gestation period for her would be about 22 days. She can have a litter of about 6 to 12 pups, and you can wean them off about 21 days. So rats are polyestrous, so they have a continuous heat cycle. So their estrus cycle can last about 4 to 5 days. So in these little guys, they are continuously in heat. Okay, so today I'm going to be performing a physical exam on this little female rat. So first I'm going to be listening to her. She can get out of the towel. Okay, her heart rate is good. It's about 320. So next we're going to be checking her eyes, if she'll let me. Come here, new one. Come here, good one. She's a little camera shy. Sorry. Okay, so her eyes are nice and clear. Her ears look good. There's no discharge from her mouth or from her nose. Her teeth look really good. She's in really great body condition, and her tail looks undamaged. So looks like we're having a pretty little healthy rat. Okay, so today what we're going to be doing is we're going to be doing a subcutaneous injection and intraperitoneal injection on a rat. So we've got our nice little volunteer here, Crystal. She's our nice little volunteer for today. So I'm going to start out doing a sub-Q injection. So I've got my little alcohol swabs here. Make a tent. The needle off. Aspirate and push. That's our subcutaneous injection. Now for our intraperitoneal injection, I'm going to pick her up, turn her upside down, make sure that the left quadrant angle the needle, pull back, nothing in the syringe, and push. And hold off. And that's how we do our injections. Okay, so right now what we're going to be doing is giving oral medications to our rat Crystal here. So I'm just going to kind of demonstrate. She's a little sleepy right now. We just did a procedure on her. So the needle syringe. So I'm just going to show you that we need to place it about this far down and push the medication. Now since she's just now waking up, I'm just going to show you how we're going to do the oral medications. So all you need to do is just open up their mouths and push the medication, and they should be taking it quite nicely. Okay, so I'm going to be drawing blood from a tail vein of a rat today. So we have our nice little volunteer Crystal. So I'm going to go ahead and wipe down her tail with alcohol. As we can see, the vein is right there. And I'm going to hold her tail, bevel up. And as you can see, I'm in the vein because I'm getting a flash. So I'm going to go ahead and retrude, and we have blood from our tail vein. Okay, so today I'm going to be talking to you about mice and their living arrangements and how they should be taken care of, kind of just our husbandry talk. First, I'll talk about enrichment and how they should have little things to do, like our little wheel here. They've got a little building block that they can chew on and run through. Here they can have a little exercise ball, and this kind of goes in hand with a little nest. I've got this out of the cage right now so I can grab them whenever I handle them. But so far as this goes, this is a great little nesting area, and the newspaper shavings go for a great nesting area as well, so they can dig under it and have somewhere to hide. So far as nutritional needs go, they have little pellets, and they can have little fruits, veggies, you know, anything that rats could have. They do have their front teeth, or their teeth that grow continuously, so they do need these bigger pellets to chew on so that they can manage their teeth, so they don't overgrow. Now, the water, you can either do it this way, or you can have a little bowl inside. This way is preferred just because the mice can get really messy, and they can tip over the bowl and they won't have any water. So this way is preferred just so they can have more access to the water and they don't get it dirty this way. Now, identification, the way that they recommend doing the identification is from ear notching. These guys don't have any ear notches, but we do mark them from coloring. So these guys have really pretty tan color, and one is fully tan and the other one is tan and white. You'll see him in a minute. And so this way we can tell the difference between the both of them. Another way people like to identify them is through microchipping. It is not as recognized as ear notching, but you know, they are starting to do it. So those are the ways that you can definitely identify your My Spy. Now, so far as handling goes, what we want to do is pick them up by the base of their tail, not too far back, because we don't want to damage their tail and take off those scales. So what I'm going to go ahead and do is reach in and grab one of them and transfer them over to this cage right here. So, see if he'll let me grab on him. These guys are really fast. Come here. Come on. So I've got this little guy, just pick him up, and a way we can restrain him is just by putting him right here on the top of the cage, and then I'm going to go ahead and place him into our new cage over here. Okay, so in this video I'm going to be showing you how to restrain a mouse for procedures. So what we're going to do, go ahead and grab her up. No, honey, come here. Grab them by the base of the tail, and a lot of the times they'll feel a little bit more comfortable when they're on the top of a cage or anything like that, something that they can grab onto. So with the base of her tail I've still got, so I'm going to go ahead and scruff her. Alright, and so this is one way that we can restrain them for procedures. So to hold her a little bit more, we're going to go ahead and just place her tail in between my fingers right here. So this is one way we can restrain a mice for procedures. So another way would be for another kind of like a tube that we can fit over them, or a plastic pastry bag that they can, you know, put some little holes in the bottom and they will be able to breathe that way. So this is another way, or this is ways that we can restrain our mouse. Okay, so in this video I'll kind of be talking about reproduction and sex determination for this little mouse. So far as reproduction goes, this females normally mature about 50 days, and they are polyestrous. So their estrous cycle is about 4 to 5 days, and they can, after mating, they have what's called a vaginal plug, which determines whether they have mated or not. And they can have up to 10 to 12 pups per litter. So we normally tend to tell clients that if they have a male and a female, that they can have up to 7 litters per year, up to 12 pups per year. So normally during this time, if they are if the owners want to mate again, then they need to catch them during the post-estrus period. So this is kind of, this is how they reproduce. So I'm going to show you on this little one the sex determination. All right, baby. All right, pick her up. Sorry, love. It's okay. All right, so if you can see here, you can tell that she's a female because her genital papilla is close to her anus. Normally, if it was a male, it would be further away. Okay, so in this video, I'm going to be doing a PE, or physical exam, on this little mouse. I've already determined that she's a female, and so I'm just observing her right now. She looks pretty calm, alert, and fairly healthy right now. So I'm just going to grab her up. Baby, you're okay. Okay, switch hands. All right. her a little scruff. It's okay. It's all right. I'm going to go ahead and re-grip for her. It's okay, baby. Okay. All right, so I'm just going to check her teeth. They look really great. Her eyes look clear. Her ears are clear. I'm just going to take a listen for her. Okay, her heart rate sounds strong. And her lungs sound good. All right, normal heart rate for these guys is about 400 to 600, and normal respiratory rate is between 91 and about 215. So I'm just kind of checking her out. Make sure she doesn't have any, lumps or bumps in her abdomen. Everything looks pretty good. Her little vaginal opening looks good. Her feet look good. So I'm going to deem this little mouse pretty healthy. So I'm just going to go ahead and set her down. Okay, so in this video, I'm going to be doing the sub-Q and intraperitoneal injections and the oral dosing for this little mouse. Okay, so I'm going to start off. She's kind of trying to escape from me. So I'm going to go ahead and do the sub-Q injections for her. All right, so just going to grab her scruff. All right, do bevel up. Aspirate and push solution. Okay, and for the intraperitoneal, I'm going to have my helper Sandy hold her for this. Okay. Tilt her upside down a little bit more. I know, I'm sorry. I'm sorry. Okay. Okay. All right. So we're going to go ahead and go for her left quadrant. To bevel up. All right. Nothing in the needle. And push. Okay. All right. And then we're going to be doing the oral dosing for her. All right, so we're going to go ahead and lube up our feeding tube here. And then go ahead and place it in her mouth. Go to the back. Okay, there we go. And push the solution. Okay. All right, and this is how we do our injections and our oral medications. Hi, okay, so today I'm going to be talking to you about kind of the husbandry for a rabbit. So we've got a rabbit in here. She's a little nervous, so she's kind of hidden back in the corner. But as I'll show you, she's day boarding today, so we've got some newspaper on the bottom of her cage. This is kind of just a stainless steel typical kennel cage. We normally put newspaper down, put some Timothy hay in with them, and some Timothy hay pellets. So, so far as nutritional diet goes, we recommend this for owners, as well as having carrots, fresh greens, vegetables. We really like the hard pellets to keep their teeth down since they grow continuously. That really cuts back on any cost savings as why as they don't grow out. So far as being able to identify them, we normally write down any kind of
identifiable markings. Normally they will have markings tattooed inside of their ear. They may have a microchip. Normally tattooing is more common. So far as feeding goes, normally we need to change the food out every single day, sometimes twice a day. Water, same thing goes for watering. Right now we've got a little bowl in there for her. Normally she would have a water bottle attached to the cage, but since she's not in her normal housing, we just have a water bowl in there for her. So normally that's how we pick up our rabbits, and just kind of demonstrate how we've got her in the cage right here. As you can see, she's got her Timothy hay, her newspaper, and her bowl. Okay, so today we've got Mama Rabbit here, and I'm just going to be demonstrating how to restrain a rabbit. So just whenever we normally get them out of the cage, what we would normally do is I would take her by her scruff right here, pick her up, and so they don't struggle. We need to support their back legs so they don't kick out, because they can break their backs. And you just kind of take them in your arms and hide their faces whenever you travel with them. So this is one way we restrain the rabbits. Now for examinations, we normally just place the rabbits down, kind of wrap them up in a little bunny burrito so they can't escape backwards, and now she can't escape forwards. Okay, so I'm going to be talking to you about how to determine sex and just the reproduction of rabbits. So here we have Mama. She's a girl, and so far as her reproduction goes, normally the New Zealand white is considered an animal model for laboratories, and they normally start breeding about 5 months of age. Their gestation period is about 29 to 35 days, and they can give up to a litter of 4 to 12 kids. So normally these breeding systems, they are put in with males and are bred that way. So whenever they are put into the breeding system, ovulation starts. So, alright, so determine the sex for these guys. I'm going to set her on her bottom right here. So I'm just going to kind of feel around here, and it doesn't seem that she has any testicles, so I'm going to push up on this, and it looks like she has a vaginal opening, and as far as this, we can determine that she is a female. Okay, so today we're going to be performing a PE physical exam on this rabbit, Mama. So she seems fairly healthy and good body condition, so now I'm going to be listening to her. Sure that she's got good heart sounds.
That would make how many toys now? Well, this is the one I bought for them.
Okay. Her heart rate is about 190. So another important thing to listen for in rabbits is GI sounds. Make sure everything's moving around in there. And I can definitely hear some gurgling, so that's definitely good. We've got things moving through in there. She's got good breath sounds. So next I'm going to be moving on to her ears. Make sure she doesn't have any debris in there.
Alright, baby, would you like to get your things off your feet?
Everything looks good in there. Now I'm going to be examining her mouth to check for her teeth, see if there are any malocclusions or anything like that. You see? Girl. It's okay. I know. Sometimes they make this a little bit difficult because they stick their tongue right in the scope. Okay.
Okay, everything looks really good and smooth in here. So she's obviously been eating her pellets. All right, so after that, we kind of feel around, make sure she doesn't have any lumps or bumps that we're not seeing on the body. All right, now I'm going to flip her over and make sure that she is doing well and nothing around her vaginal opening. So this is how we do a PE on a rabbit. Okay, so today we're going to be doing some oral medications. So this is kind of how we restrain the bunnies. We got them in a little bunny burrito by the towel. And the way we give the oral medications, we're just going to go ahead and get a syringe in their mouth and just push the fluid. Rabbits are notorious for spitting it right back out. So normally we're going to just tip the head back just a little bit so she drinks. Alright, so we have Mama here and we're going to be giving her a sub-Q injection. So normally sub-Q injections are preferred in the scrub. So I'm going to ask Jennifer here to just kind of restrain her softly but firmly so she doesn't escape from us. So I'm just going to go ahead and give her a sub-Q injection. This is a 25 gauge needle. Now rabbits have really thin fur or thin skin, so we just need to make sure that the needle doesn't go all the way through. Aspirate and push. Okay, hold off. And that's how we give the sub-Q injection. Okay, so we have Mama here today, and we're going to be doing an ear cytology and ear cleaning on her. We're mainly checking for ear mites. That's one of our main reasons why we have rabbits come in here, is because they're itching a lot in their ears. So, so I'm going to go ahead and take a look at her ears, see what we've got going on down there. Okay, well, it looks like there's a little bit of wax in here, but otherwise the ear canal looks great. This ear, the ear canal is completely clear, so this ear looks great. So we're going to just go ahead and swab for her ear mites, for her possible ear mites. That was her right ear. Alright, just go ahead and do that cytology first. This is her left ear. Alright, okay, so I'm going to go ahead and do the 3-dip stain. So I'm just going to leave that in here. And now we are going to be checking for ear mites. So we've got our mineral oil here, and I'm going to go ahead and dip it onto the slide. Okay, so now I'm going to be swabbing for ear mites. So I'm just going to go ahead and take the swab. See if we can't get deep enough to get all most of the ear mites. Right, so I'm just going to take my swab and rub it in the mineral oil. And then I'm going to go for the other ear. Okay, and do the same thing. All right. And my cytology is done. So I'm going to go over to the microscope and read these. All right, so I'm going to go ahead and take a look at the ear mite slide first. Try to focus in on a good sample. And then I'm going to go to 40 power. And this looks like a pretty clean sample, so there doesn't seem to be any ear mites. Now I'm going to be switching to my ear cytology. So I'm going to go ahead and look at the right ear first, and I'm going to try to focus on a good sample that I can see. All right, and then I'm going to be switching to the immersion oil power. Okay. Now, the right ear was the one that had some, it looked like a ball of wax in it, but this right here looks like it's a little yeast in there. So normally what we'll do is just treat with some Otamax. And I'll go ahead and show you. Now, so we're going to go ahead and take a look at the other ear as well. All right. Alright, and this ear is completely clean, so more or less we just need to treat the right ear. So I would say that the right ear was probably 1+ yeast and the left ear is completely normal. So now we're going to be cleaning her ears with our cleansing solution and our otobiotic. So what we're going to do, we're going to go over to this right ear and just pour in the cleansing solution. And we're going to give it a good squish around. And we're just going to go ahead and just do the right ear since the left ear wasn't affected. All right. I'm going to take my cotton swabs, clean out that ear, see if we can't get the chunk of wax out. Okay. All right, so let me take a look in her ear, make sure that we've got everything. Okay. Looks like that wax is completely out. So now, since we kind of irritated down in that ear canal, we're just going to put some Otamax in her ear and do the same thing with the cleansing solution and just squish it on around. And so this is how we do an ear cytology and an ear cleaning on a rabbit. Okay, so here we have our rabbit mama, and we're going to be doing a blood draw for her today. She's down for dental, and our owner signed off on us doing a blood draw for my school. So I'm going to go ahead and do her blood draw. So I've got my insulin needle for her tiny little veins. I'm going to go ahead and alcohol. Now normally we do ears for these blood draws, but since her ears are very tiny, we're going to go ahead and do her back leg. Okay. All right, and now we've got our blood for our blood draw.